Health Check is sponsored by Alliance Health, Durant.
The rotator cuff is a combination of 4 tendons that allow for strength and range of motion of the shoulder above shoulder height. These can be injured by lifting too much weight, rotating the shoulder in an awkward position, or by wear and tear when the two bones in the shoulder rub on each other and impinge on the tendons. The symptoms of rotator cuff tendonitis, which is a strain or inflammation of the tendons, or an actual tear of the rotator cuff, are pain and loss of range of motion, especially above shoulder height. One of the most common signs of a rotator cuff problem is night pain in the shoulder. If the rotator cuff is just sprained, this can frequently be treated with a simple injection in the office or with physical therapy. However, if the rotator cuff is actually torn, this requires surgical repair to reattach the tendon to the bone so the patient can regain function of the shoulder and eliminate the pain. The newest techniques for rotator cuff repair, either arthroscopically or with a mini open incision, are done as an outpatient procedure and generally take less than an hour to complete. This technique involves 2 rows of anchors that go into the bone with sutures that come up to capture the rotator cuff and bring it back down to its original position so that it can heal. The good to excellent results of rotator cuff repair are approximately 95%. Following rotator cuff repair, most patients will go to physical therapy for 6 to 8 weeks for rehabilitation to regain their strength and range of motion. I'm Dr. Chris Leslie, orthopedic and sports medicine surgeon at Alliance Health Durant.